What is GenCare, you may ask? Well, joining me now to talk all about what GenCare is and the services that they offer, please help me welcome Dr. Stephen Youngblood, the Medical Director for Kenner. Hello, my good sir.
Thank you, sir. How are you?
I am wonderful. Thank you so much for letting us in here. So excited to be talking about GenCare today. My first question for you, for those who do not know what GenCare is, tell us about it.
Sure. We are a primary care providers in a clinic, and we serve the senior population. We define it as people over the age of 50. We're here to provide them through their medical needs. We focus on treating complex medical conditions, managing medicines, and quarterbacking their overall care.
I think that is awesome. I know you all have 4 locations right now and you're working on a 5th. Why did you choose to deal with senior citizens?
So one of the components of our company's vision is to take care of the neediest of populations. And it was felt at the time that senior citizens are definitely a needy population. As they go from the working components of their lives to the retired components to being at home, we wanted to be able to provide the support. These individuals have very complex end-stage medical problems, and we're there to try to support them through it and hopefully improve their overall function and health.
And again, they work with anyone over the age of 50?
Our target's over the age of 50. The older the better.
The older the better, I hear that. What are some of the services that GenCare offers?
Well, we provide transportation for those who need transportation if they can't make their own way. We have same-day office visits, we have emergent office visits, and we have just chronic daily visits where if a patient has diabetes and we're just helping them with their blood sugars, going over their blood sugars, we can do that. We have home nurses that go out and help us coordinate what's going on in the home, making sure that additional services like home health and physical therapy, if they're needed, that they are coming to make sure we're getting it done the right way. We have some services for when patients, if they unfortunately go to the hospital, that information is communicated back to our doctors. So they can, our providers, our primary care providers can really be a good quarterback and a good overseer of this individual's overall health.
I think that is awesome, and I know you, my good sir, are the medical director out at the Kenner location. You've worked with many different patients before. What are some of the things that they have told you about their experience here at JenCare Senior Medical Center?
Well, we actually do a lot of surveys with our patients to get constant feedback. So we can always improve what we do for them. One of the things, they'll get text messages and phone call surveys, and we go through those results and we read about what they say, both good and bad. And we always try to make sure if there's a bad comment, we go out there and talk to the patient and learn from that experience. Personally, in personal conversations with them, you know, they tell me lots of great things. You know, they talk about the fact that they can walk in, the fact that I know a lot about their medical care, what's going on with other doctors. And I think the thing that really connects with them is the fact that they can reach me just about any time through text or phone.
You all do that personalized connection, which I think is so great. It is really awesome that you all are doing things like that. Now, I also wonder, for people who are wondering what the GenCare Difference is, I know we talk a lot about the GenCare Difference. What is the GenCare Difference in your opinion?
I think the GenCare Difference is the fact that we spend a lot of time, not necessarily in any one day, but over the course of a year. We're making multiple frequent touches. I've texted patients, I call them on the weekends if I think they need it. They call me. So we were having a lot of little interactions. And all these little actions over time add up to a lot of time. Amazing. And so we get to really know them, and they get to really know us. And they learn when to call us, and when, if it's a big enough emergency, when to go to 911. They can avoid unnecessary ER visits, which in today's world is huge, right? ERs are a prime area where COVID could be. And I think it's a real connection between the doctor and the patient, which for a lot of people is hard to have nowadays.
And what is the benefit of making sure that you have that connection with the patient?
I can have in a conversation when a patient walks in to see me, I'll know right away when I ask them how's things going and they go everything's fine. I really know if it is or not. I've gotten to know them. I know their small behaviors and their habits. And so I can really try to actually manage very well or help them achieve what they really want. Just today with a conversation with one patient, I said, you just need to go outside and walk. The weather's beautiful, you've been stuck up for months, put your mask on and go walk a mile. And she texted me a little later and said, I finished the walk and I feel great.
I love that, the GenCare Difference connection, and I can feel that. Thank you, Dr. Youngblood, for joining us this morning. And hey, do not forget, there is a hotline that is open right now. All you have to do is call the number on your screen right there. 504-684-7572 is the number to call. Again, they are open right now, answering any questions you may have about GenCare.